This is about a 60-year-old lady from her village. She came to our hospital as an outpatient as she had fallen down 3 days back with trivial injury, and after that she couldn't move her left hand due to pain. You can see her left hand X-ray and you can compare it with her normal X-ray right hand. Do you have any findings? I'll give you the findings here. There was no fracture and no soft tissue thickening. We suggested splinting for her, but she refused it, and that's why she was sent home only with analgesics. But she came back to the hospital after 6 months with no pain, but she had lot of changes. Now we can see her X-ray and CT of left hand. What are all the findings? And what's your differential diagnosis? If possible, you can give your probable final diagnosis. Okay, I'll give you the findings. There is extensive destruction of the carpal bones in the radioulnar bones, most at the radiocarpal joints, disorganizing and dislocating the joints. Also noted there is increased density in many of the involved carpal bones with debris and distension around the wrist joint. All of the findings are well seen in the given CT section. So the diagnosis is, yes, you know now, come on. Okay, I'll give you the 6Ds which are already mentioned: destruction, dislocation, disorganization, density, debris, and distension. Still, if you don't know the diagnosis, please just wait. After discussing with the patient, she told the fact that something had been injected into the wrist joint by the native village compounder on the same day when she had visited here 6 months back, and after that her pain had gone. Now I'll give you the mnemonics of 6S which are prone to give the disease. They are: one is sugar of diabetes, second one is steroid use or steroid injection, third one is spirit of alcohol, fourth S is scleroderma, fifth S is spina bifida or spinal cord injury, and sixth one is scaly disease of leprosy. So sugar of diabetes, steroid use or injections, spirit of alcohol, scleroderma, spina bifida or spinal cord injury, and the scaly disease of leprosy. So the differential diagnosis is neuropathic joint or Charcot joint with a history of injection. Probably it could be steroid injection. But if there is a steroid injection without any steroid injection, the DD could be Gorham massive osteolysis, Kienbock's disease with severe degenerative changes, or erosive osteoarthritis with severe degenerative changes. Finally, don't forget the 6Ds and 6S of Charcot arthropathy or neuropathic joint which have been described. Most of the times the foot is involved here, but that's why neuropathic joint is almost considered synonymous to neuropathic foot by many of us, but it is not correct, because less commonly it can involve the shoulder and spine, and very rarely you can involve the wrist and hands, which are still encountered in rheumatoid arthritis with chronic steroid misuse or also in scleroderma. So that's the diagnosis: Charcot joint or neuropathic joint. Thank you very much. Bye bye. Take care.